Thank you for joining us today. We are here in the studio of Cypress with Laura, James, myself, Shayla, and Unique. Today we'll be introducing you guys to a group called Dmards. Have you guys heard of this disease-modifying group called the Dmards?
We haven't.
Well, if you guys haven't, here are 3 things you guys need to know. Dmards stands for Disease-Modifying Anti-Rheumatic Drugs. The progression of tissue damage caused by rheumatoid arthritis can be slowed or modified. Research has shown that these drugs improve symptoms, reduce mortality rates, and enhance the quality of life in patients with rheumatoid arthritis. It's classified as biological therapies or non-biological therapies. Now that you guys know the basics, let's discuss.
Wow, that was an earful. Thank you for that information. Now we're going to tune into Laura. Let's hear about those side effects.
Hi. So earlier we talked about what rheumatoid arthritis is. It is an autoimmune disease where overstimulation of inflammatory response in synovial joints. You have 2 kind of drugs. You have the non-biological response, and then you have the biological response drugs. There's 2 kinds that we'll be talking today for the non-biological. This is the hydroxychloroquine and the methotrexate. Essentially, this piece of toast here will demonstrate what those drugs do. This piece of toast is a macrophage. It has this little thing, which is an MHC protein complex, and it attracts these things called antigens. Essentially, this causes an inflammation in your synovial joints. And what these drugs do blocks this inflammation. Same thing goes into the biological response. You have this Xeljanz here. Instead of a macrophage, you've got these things called cytokines. They attract white blood cells, such as histamines, and then that creates an inflammation in your body. Essentially, like what we said, Dmards will decrease inflammation and get rid of pain. Side effects, our favorite part. First common side effect that we will find, headaches.
Oh, my head.
Next is vomiting. From there, you'll have nausea.
I don't feel very well. I think I'm dizzy.
And the last common side effect that you'll find in all of these drugs is diarrhea.
I need to go to the restroom right now.
And then from there, we have a ton of major side effects that just goes on and 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 on. But beyond that, let's talk about the 3 major side effects that we should be looking for. First is seizures. Next up is upper respiratory infections, such as colds and sinus infections.
I don't know how to do infections in my throat.
And from there, it gets deep down into the blood. Aplastic anemia.
I'm so weak.
Thank you folks for listening. Now, let's get to Miss Unique Hiller.
Thank you, Laura. Now that we got those side effects out of the way, we are here with James, our Rookie of the Year.
Hi.
Hi. So the world is very curious. What do we need to know about this Dmart drug?
Well, the primary concern for any disease-modifying anti-rheumatic drug is a very high risk of infection. Being an immunosuppressive therapy, we want to make sure that this risk is minimized.
Okay.
In addition to its anti-inflammatory effects, the activity of bone marrow is actually suppressed as well. So a decrease in white blood cells may be a possibility. So we want to modify the serum levels of a white blood cell and make sure that they're not too high or too low. If they're too low, the physician will probably want to prescribe an antibiotic, a prophylaxis. If it's high, it could be a sign of infection, so we need to identify the pathogen, and the physician will prescribe an antibiotic.
Oh, good.
Also, we want to educate our patients. So if they're taking these drugs at home, we want them to be able to recognize the signs of infection for themselves. So if they have a high fever or just a general feeling of malaise.
Okay, good. So what about pregnant women? Should there be any concerns with them taking this drug?
Well, these drugs are contraindicated in pregnancy. So if you're taking a DMARD, you will want to be on strict birth control. If in the event that you would like to get pregnant, we recommend that these drugs are discontinued within 3 months of an attempt to get pregnant.
Okay. So what about foods and drugs? Like, are there any food or drugs that a patient should avoid while taking Dmards?
Well, there's no food in particular that's contraindicated. But while we're on the subject of nutrition, a low-fat, protein-balanced diet is always a good idea.
Yes, it is.
Yes, it is. We recommend cold water fish such as tuna, salmon, and trout because the omega-3 fatty acids have anti-inflammatory properties of their own.
Oh my gosh, thank you so much, James. We learned so much from you today. Now we're going to tune back into Shayla.
Wow, that was a lot of information to process about this group called the Dmards. We hope that this was helpful and that you guys learned a thing or two. But if you guys didn't, here's a quick recap of what we discussed. Thank you for watching.